this is what kind of video when this massage go wrong. So.
Oh, right.
So what I'm doing now, I'm kind of trying to stabilize the pubis symphysis. Pubis symphysis, it's right in here.
Oh yeah, that's the one. How do you know when it goes out? How do you know it's out?
It's so one ileum is get unleveled. Is right in here. It's what we're doing here right now. We try to mobilize it, not mobilize it, stabilize it. Let's say this way.
See.
So we're gonna bring this right in here. Okay. And what David's going to do, gonna spread the leg. Relax, relax.
Okay.
And what we're gonna ask him to squeeze this as hard as possible. Here we go. You feel that pop?
Yes.
So that's pop exactly. That was the pubis symphysis get back in place. Now you're gonna know. Keep squeezing.
Oh.
You lock his. You can come up camera right here, so it's gonna be better probably. Yeah. Okay. So I put my hands on the stomach. I try to activate his abdominal.
Mm-hmm.
So breathe. And squeeze, 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 squeeze. This is great exercise for lumbar area.
Wow.
Now I ask him to separate. So I come up here, separated, separated, separate. Really strong and really powerful. It's great. Is any pain?
No.
Okay, great. So this is how we do it. You see, I don't. So you bend one leg. That's the side you want to bend, right? So now watch. You bend, you place this arm. I gotta show you again. Bend this leg. Your right arm is going right on that edge of the ilium. So, yeah, and anterior sacroiliac bone. Now you roll it. You come up here, and now you see my arm is come to the body, and you just push this way. And this is how you put him in a position. Okay. So you put him in a position. He kind of a little bit in twist. You come up here on this lumbar area, and this is what you do. You create a lumbar curve. Yeah, but this is also chiropractor adjustment, but we're not gonna go that way. All right?
So you do that on both sides?
Yeah, you do it on both sides.
I see.
Imagine big
And then-
guy.
Yeah.
So
can't
if
do
you
that.
do that for a series of sessions, it gives you more space or more curve?
Yeah, lumbar. So you see what you're doing up here. You kind of this leg is pushing this way.
Right.
So you see you creating. You can actually go more neutral right there. And what I'm doing. Okay, hold on. I have to be right on my hip, and you just create that.
Right.
You feel
I
that?
see, yeah.
Okay.
I see what you're saying.
Yeah. Let's switch it. Yeah. Did you watch it?
Yeah.
Yeah, it's a good stuff. So same with Marina. We're gonna do the same. So we're gonna bring this leg up. See the pubis symphysis. Always separate, big, like pretty good distance right here, and we're gonna ask her to squeeze. And I shake it up a little bit. I feel this one is weaker, right?
Yeah.
Yeah, this one is really weak. This one is really strong. I can feel it push, but this one is not.
So that's coming from lumbar?
And go active. You see stomach. Try to activate here. Breathe and activate this. Yes. Yeah, right there. You see, so she's not turning her abdominal muscle. So she's not turning this one up. Let's separate it. Let's separate. How's it feel?
Good.
Good. Same thing. If you do this side, you're pushing right here. You can. Some people cross it. I don't, so I push it right in here. Come up on the other side, support it, bend her this way, and when she's like halfway there, I push her this way with my arms.
Here I had a little pain.
Okay, she have a pain, so we don't want her to put too much in. Relax. She's like, she thought I'm gonna do something. Jeez.
You're scared now.
No, we can.
No, I think it should be here.
Yeah, you want to pop. I know you want to crack. So
Oh, okay.
we don't want to crack you because. So what I'm doing, I just create this lumbar.
Does that feel good? It felt like it opens it up.
Yeah.
But like I said, this is not.
It's here. I have a little pain.
This is SI joint, huh?
Ow!
SI joint.
You see, you're not supposed to do that.
But this one is better, you know? Yeah, I don't have pain here. Oh, okay.
Okay, we're not supposed to record that. I mean, don't worry about it. Okay, I can just chop it off. Okay, so she have pain in lumbar area. We're not supposed to do all this kind of stuff. What I did for the David. Now, what we want to do, we already manipulate the pelvis and pubic symphysis, sorry.
Mm-hmm.
So now I want her to restore that movements. What I'm gonna do, I'm gonna ask her to squeeze my arm and go ahead, do bridge. Push your, squeeze my arm. Yes, let go. Up and down. Breathe. You see, she try to compensate right now. This arm is gonna be like you do push up, like air push up. Create that, like that, like you're pushing something. Yes.
Yes?
Yeah, you can put them right there. Go up and down. Keep squeezing. I think 15 times.
So that helps your lumbar.
Yes. Up and down. Squeeze. Hi, Natalie. Squeeze. Good. Now I want to do separated. And that's actually great for the negative for Natalie too. So separate it and do bridge. Yes. How's it feel? This is the great exercise for the spondylolisthesis. This is what we're doing. Very slowly. You see, she's like, where are you rushing? There's no fire in the building. You have to just breathe and control your movements. Yes, great. After like couple weeks, you can start doing a one leg, single leg. What do? Here, you place right in here and do with one leg, and you're gonna see which hips. You'll do it again. Perfect. If you're gonna start burning in your hamstring, let's tell you something. Because we put too much pressure in one side right now, and if this, like, how's your hamstring feel? No spasming in the hamstring?
No.
Good. Yeah, she's pretty healthy. Let's switch other leg. This is what you do with your customers, right?
Now, this is good for anyone who is weak in their low back too.
You see, you feel weaker?
Yeah, a little.
Yeah.
This one, it's harder, you know?
Yes. But now you can ask her to do more and brace this way. Yes. Do you feel burning in your hamstring now?
Yeah.
Yes, it start burning. So we need to really be careful. We're not, like I said, 10 days she's have to do just the bridges, or you do bridges all the time with her. Let's say I go to the Sam, I will do with Sam bridges, like stuff like that. Next one, what I want to do, it's increase more stability in her pelvis. So remember, if this is anterior tilt slip disc with the spondylolisthesis, so the disc is go forward, we want to go backward. So what we're gonna teach her to take this pelvis and bend like backward, this way. Okay, if she can do that, we have to bring the legs up here and just hold it up here. So I want you to bring this pelvis not to forward, backward. Try to like bend it this way. Watch. Yes, like this.
Stretches
very
your
slowly.
psoas.
Yes, slowly. Slowly.
It means I help you doing
Yes,
that.
yeah, I'm helping you. Yes, you do it with me. So I want they do it with me. Pain in there.
Here.
Okay.
When you go forward, right? When it's forward.
Yeah, I'm going forward.
Okay, so
So psoas maybe.
she don't have spondylolisthesis for sure, for 100%, because we did this test and she never have this. But yes, her hip flexors might be tight. So what we're going to do, we're going to try to release this right now. And you have to go breathe. This is how we work. I have to supposed to be on that side, but for the camera, and I'm not going perpendicular. So navel, the rib, and it's have to be right between them. So this is where the spot is. If you're not sure, you just ask her to do this movements, and it's gonna pops up right under your arm, right there. Yeah. Okay. She's like, ooh, yeah. Yes, I'm always tell the people when clients, when you try to go sleep, when you lay down on your stomach, what you do, you start massaging your stomach. You start pulling this up. So you kind of like, if you're laying up here, you ask your two arms and you kind of pull pull. Yes, gently. So you work with the fascia. You don't push too hard on your stomach. You just kind of, yes,
You're
open
face
this up.
down. You have them do it when they're face down.
Face up, just like that.
Face up, okay.
Just like that. I'm always massaging my stomach because when you lay down sometimes on the floor, you can feel you're not even one side, right? Like one spine. So side is more effective. I will probably be massaging. Yeah, go ahead, massage your stomach. It's really great stuff. Yep, but now we're gonna come back to this OS. She might have like SI joint pain too. Sometimes people overstretch. She's a yogi people, and overstretch all the time can create this inhibition in the muscles and inhibition in the joints, and that's when you're going to be caused the problem. That's why yogi people sometimes like in pain all the time because they stretch and inhibit muscle. So they always try to mobilize lumbar area. I'm not sure. Lumbar area is supposed to be stable, not the mobile. You can mobilize your rib cage, you can mobilize your hips, but stay away from the lumbar area. And all this like twisting asana, it's not sometimes good for you, okay? How's it feel? Try to raise your leg up. So this is what we do, but actually now we're working on the PSOIS muscle, which is also going to help with the spondylolisthesis, because one side is higher than the other and you try to balance it and it's help. You see how high this hip is? Look. You see? Like a super hip. Yeah, so now we're gonna treat it. Let me get the camera up here. We're gonna do a lot of editing. David, let me just
Yes, go ahead.
yeah, let me just put the camera. All right, so yes, as you can see, I put the fingers this way, and you can see this one is really high. So this one is lower, this is the high. So this hip is everything is tense up here. So that's what the mean. She's leaning one side more than others, so she's standing on that side more. That's why. Here we go. Feel the pop. Like I said, how to find it again. So it's navel, rib cage, and you just go right in the middle. And you gently, without any angles, you just slowly get in there. People use the massage gun, Theragun. Not a good idea. Not a good idea. Yeah, not a good idea. Have to be really gentle. You have to be very, very know where you're going. Especially on the left side, we have this lumbar aorta. Yeah, you don't want to push against that.
You also should do a video on Theragun, what to do and what not to do. Because that is everyone's got one.
They're gonna sue me. They're so powerful.
They'll sue you.
They sell so many Theraguns, so there's so much money in the expensive lawyer. No, I don't want to say.
My client calls it a machine gun.
Machine gun, yeah. I would say.
I got one from Christmas, actually.
Yeah, I would say legs. You can do everything on your legs,
Yeah.
but nothing up. Some people do on the neck. This is
Back.
this is insanity. Like, yeah.
What about their back?
Well, yeah, but you could do a do's and don'ts of like, do this with the therapy, don't do this.
Or
Yeah.
be careful. What about your paraspinals? Can you do it on the?
Yeah, it's
You don't like it.
kidney up there, right? There's a kidney up here.
Yes.
Yeah, if you got kidney stones.
You gun them out.
Gun them out.
Oh, okay. I want to see you when you start peeing with the kidney stones. When you just like, I don't know.
It's so painful.
It's really painful.
I've never had them.
Okay, it's better for. I mean, your woman. It's still painful for the woman, but for the man, it's super painful.
Yeah.
That's why you guys drink a lot of water. Okay. All right. So we work on this. PSOS. Now what we're going to do, we're going to activate those muscles. So we're going to pull this way and ask her to resist me and pull. Yeah, so basically what she do, she like a hip hike her hip and let it go. And you can see she's really balancing, try to You see what's with the upper body, what's happening with our upper body? Let it go. Just look at her upper body. She twists her upper body to watch. Pull, try to pull, you see? So she didn't activate her core. She wasn't. Okay, now we're gonna see what we did. And we already remeasure it and we drop this hip down. Now we want to do exercise. Exercise we want to give her kind of work she can do at home, at her bed, yes. So the first one, we're gonna ask her to raise this leg up. You're gonna place your hands right in the back. And I don't want you to raise so far, you just kind of basically a little bit, okay? So I'm gonna help you out. I'm gonna help raise this leg and you kind of move. And let it go. So we're gonna do one leg first. That's it. How's it feel? Good. Okay.
Every day I'm doing this exercise.
Yes.
It's the same thing.
You
Yeah?
do? Yeah. Do a couple more times. And let's try to do other leg. Let's see if any. How's it feel? You feel good?
Yes.
Okay. Very slowly. So I raise it up. She kind of tilt forward. Okay. And let it go. She not do crunch. We just activate upper body. So it's flaccid. It's flaccid. It's also great for the sciatica pain. All right. So next one, what I want to do with her, it's teach her to stability. Okay. So this is going to be a little challenging for her. I will do it. It's also always good to have those balls. You guys bring it with you. Trust me, this is you save your time. You make people happy. You save your hands. And what I want you to do up here, right here. This is really powerful. You can do push up like you did, like here, like push up. And what I want you to do, you start doing raise your butt. Yeah. This is create stability in her. This is great exercise. How's it feel? Challenging, huh?
No.
No. She's really good then. Okay, if she's that good, you can do one side first. So try to do other side.
This is challenging.
Yeah. Boom. Yes. Come on. You see? So this is let's try other leg. Let's try other leg and try to do this one. This one is more powerful actually. Oh, you see. So what we did, we really we get some instability on her. So before, remember, she said this one was weaker, right?
Yeah.
Now this is one. So you don't have stability in this leg. That's how we find out. But yeah. So this is kind of really advanced. The really easy one, you can tilt it backward. Tilt it backward. Next one, it's you're gonna scoop a little bit close to the edge, and this is what you do. You give them to band or the belt or the band. So the band, and what you do in here. This is great. This is great treatment for the customers. So you come up here and you give it to them. See, you hold it, and what I want you to do, like put some pressure. And you try to extend this right in here, and release. I have to be belt right there. Yeah, you can do wider. There we go. They have to do this on your table. They have to do this with you because they're not gonna do anything. And just extend and hold it right here. There we go. What do you feel? You feel in your hip flexors and your spine? No, you don't feel it?
I don't feel anything.
You don't feel anything?
Maybe I do something wrong.
No, you're doing okay.
Maybe I don't know.
Hold it right there. Just hold it, yeah. Do you start feel something right now?
Spine.
Okay, yeah, you see? So
Yeah.
this is probably a little bit light band, use like 25 pounds band. She's gonna feel it in the spine, and this is really gonna help this correcting the spine and make its core stronger. Okay. I forgot another one, just last one. But that's okay. Yeah, you feel it now?
Yeah, now it's.
Oh, you
it's
feel it
good.
is good. So, spondylolisthesis. The vertebra slide forward, right? We're not pushing on the spine. If we're pushing, people feel pain. Okay, so we stay away from that.
Lower back,
Yeah. And most of the time it's referral down.
foots.
Okay, let's turn your face down now. I'm just gonna mention from my experience. Maybe you guys want to share yours. There we go. Let me put this up here. All right. Yes. I mean, basically, I finished what I wanted to talk about, but let's do another lumbar area. So a lot of people come to the clinic. They say lower back pain, and they ask you dig in there. I don't know, use the elbow, jump, but what are you looking for here? If any postural problems, I mean, you already look at when person was standing, now the person is laid down, and what I want to see the twist in the spine, and I want to see this lower dose. So as you can see, she had this curve, right?
Mm-hmm.
She had the curve. So most people, they started massaging this muscle. So release that tension. If at least if this is normal, healthy person without any problem, I will recommend, if you see lower dose, you always push that muscle away from the spine. So you create that curve back. So you restore this normal curve of the lumbar area. If you push toward, you're gonna do more curve. So what you want to do, you want to push away from the spine when you see lower dose, and when you see, the flat back, you push toward and create more arch. But if you see a lot of spasming muscle around the spine, let's say she's have a lot of spasm, I am not going to release those muscle tension. Why? Because she might have a disc problem, and the body being just go that way for many years, and they try to protect this area. What I'm doing with this, I'm like, I know she's gonna feel good. I found those erectors, and I'm lumbar, in QL muscle, and try to release it. Next day, I'm 100% she's gonna be sore or experience more pain. We have this in the past in the clinic when therapists overdo stretch this spasmodic muscle, and it's create more pain. So that's what I just want to guys let you know. Don't push, don't try to release, and don't try to help with the first time. Just find out what's the problem. Okay, you doing good?
Mm-hmm.
All right. Any questions, any experience from your practice? But like I said, I will highly not suggest to.
If someone's got scoliosis, it's okay to do that too.
Scoliosis, yeah, it's a different story, but if scoliosis, I always put the person in the side. She's actually have scoliosis. She do have scoliosis. We can actually find out. Yeah, it's right in here. It's actually curve. So you see a curve right here. So we have what's the decavitation. So this is the cave.
Oh.
It's in, and this is like rounded. So it's rounded this way. So muscle is spasming on this side more. Yeah, I will probably do side position for her. I will not doing. She's super healthy. That's what the question is. If person's super healthy, I'm fine. Put her on the stomach and do some stuff. But if not, if she's in pain, I will probably not do any crazy stuff. Side position only. How's it feel?
I've had a couple of clients who sat funny on a couch and they bruised their coccyx bone. And it was really painful for a long time. Is there
coccyx.
anything that we can do for that, or is that just has to heal? There's pain right on the coccyx from
Yeah, the coccyx.
falling
yes.
on
It
the
has to
ground.
heal on its own. I bruised mine
from riding a mechanical bull, and what is it? I had to let it heal. There's nothing you can do with it.
No, it's okay. Maybe it's just, but yeah, you can do coccyx treatments, but you have to go
Right.
to the close to the anus, so you have to let
Right.
them know. And if you
Right,
don't
right,
know, it's a proctolog, like
Right, it wouldn't be for me, it's a
Proctologist.
specialist does that.
yeah. So basically, what they do, they go inside and they adjust that coccyx.
Okay,
Yeah.
Inside your anus?
Yeah, no, they get close to the anus and they just
Oh.
they
But
do
they
they
know.
adjust it. Yeah, they
Yeah.
know how to do it. It's a bunch of video there. You can watch Delton. He's doing that.
Oh.
Not adjust. He just manipulate that coccyx. But I will just do sacral kind of manipulation. Even maybe the what's the tarragon is going to be helpful up
Oh,
here.
yeah.
Yeah. So the vibration to the sacrum, it could be help.
Mm.
Yeah. Gentle vibration. But here, yeah, she has scoliosis. I will probably put her on side position and push toward. So if this is the rounded here, I will push her on this side, and I manipulate it that way. So try to kind of balancing this muscle around the spine.
Mhm.
You know, scoliosis is really kind of it's really tricky, and it's all you. Yeah, you have to take those specific certification on scoliosis. I'm not the guy who's gonna tell you about the scoliosis, because it's if this is twisting one side, it start twisting all around.
Oh.
It start twisting all the way to the neck. You know that.
Mhm.
You know that.
Mhm.
But yeah, you're right.
And so with that, the hamstrings are usually overstretched. They're very weak in here too.
Mhm.
When they have a lot of low back stuff, right? You find that
Yeah.
this needs to be more relaxed. The hamstrings need to relax.
Eccentrical load is the best one.
Yeah,
Most people. Okay.
yeah.
Let's
eccentric.
let's turn around. Let's turn around. Okay. So people come to the office and they said, "Oh, my hamstring is in like a burning in pain." Let's record this video, so because
I think it's already approved.
Yeah, it's
yeah, it's I
already-
mean I'm gonna chop a lot of stuff up there, so what we've been talking about, I just want to make sure.
It's a twin sim. Do you want to start? We started.
Yeah. Okay, so a lot of people come to the clinic and they say my hamstring is like really burning or is in pain. Please stretch my hamstring. Do not stretch your hamstring. Please do not stretch your hamstring, because most of the time we have lower cross syndrome, and your hamstring is already eccentrically stretched. So they already put in this stretching position. Why? Because your hamstring attached to your ilium, to your greater trochanter and tuberosity, right? Tuberosity, sorry.
Ischial
Ischial
tuberosity.
tuberosity, yes. Attached to your, so basically to your femoral bone and to your ilium. And if my ilium most of the time tilted forward, because I have lower dose, like this way, it's already put me in a stretch. And my hamstring has become like weaker. They're weak, they send me the signal, and what most people do, they start stretching, already inhibit muscle, and that's not supposed to do that. So you have to strengthening them, and eccentrical load, this is the best to heal your hamstring. And of course, correct this. You can load your hamstring as many as you want, you're not gonna get well, because it's still gonna be in pain, and it's still hamstring because you're tilted. So you need to correct your anterior tilt, and after heal your hamstring with eccentrical load, and that's going to help. And most of the time, if you feel burning sensation, like David says, below your hip, it can be in your calf, it can be in your hamstring, it can be in your heels. That's mean you have a lumbar spine problem. It could be stenosis, it could be spondylolisthesis, can be spondylosis, all different type of issues. And that's pain referral down. You can see this map. If you feel that pain in your legs, most of the time the cases it's going to be your lumbar area, your spine, and this is really serious. So hamstring, I will show you the centrical load of the hamstring. So if we have a weak hamstring,
Hamstrings are always tight, especially after the gym.
and this is how I work. So this is how I work with the clients. It's okay to bring these bands with you. So what are we gonna ask her? So let's say, which side was it? This one, right?
Yeah.
Yeah, okay. So I'm gonna come up here and I wanna load this hamstring, right? So I can pull around myself just like that and create more. So raise it up and I want to, and I just push this way. You see I'm standing right here and I ask her just bend and release it. Like bend your legs like this and release it up.
Oh, okay.
And I'm just pushing this way. You see? I'm eccentrically load her. And look, I am not working hard up here. She's working. If we try to do massage on them and try to work it for them, it's not gonna work. Muscle, you have to send a signal to the brain. So she's doing it. Come on, push it up, push it up. So how do you feel? Yeah. Yes, it's loading. That's why we're doing that. And you can do this minute and a half. Now you release it. How do you feel?
Stronger.
Stronger. Wow. Now she's gonna get up and she's gonna be like, some people are like, oh my God, what's going on? What you did to me? And you're just like, no, you did to yourself, not me. Next one, it's eccentric load too. You can do really careful. So make sure that this band is not round, because what I did make mistake, just bend a little bit. You try to fight with me. The rounded band always rolling out and they're gonna smack you in the face. So they have to be wide and make sure it's no rip. So now you're gonna do around it and hold it up there. So hold it. What she's doing, she's also, if the hip, for some get some rotation in the hip and in your leg, so this is what we're correcting now. So what you do, you bend and you kind of pull. You pull this band too. You make it strong. Come on. Yeah, band it and release it. This one always neutral, like this. Perfect. You see?
Oh, something burning.
Yeah, something burning up there. Wow, something burning. Yes. Keep doing it. Exactly. That's what we're supposed to do. And that's what's going to help him out. If this is older person, yes, we're going to give him a lighter band. Burning. So that means something going on. Next one, after she done that, we're gonna go from outside. So we're gonna
nerve? What is that?
Nerve.
What is that?
Jesus, yeah.
Oh my God.
Oh, you got spasming? You got spasm? Wow.
Okay.
So no, what's that mean?
This is the weaker leg.
Exactly? She never used this in her life, and now it's gonna activate it.
It's probably cramping too.
Yeah,
Right.
it could be because she never used that. So it was outside. Now it's inside. So hold on. You come from here. No, what? You go this way, and you did outside or inside? It was outside, inside.
It was outside.
Yeah.
Okay, now you're inside. Same thing. So this band is.
Oh no, it was that way. Sorry.
Okay, if you go this way, you go
Yeah,
that
yeah.
way. Okay, perfect. You do the same thing. You bend it, and listen. Don't rush. Don't rush. Like couple times. You push. Basically, what you do, yes, and try to go straight. You see, boom, right there. If people can't go that far, they can start doing up here. Come up here. They can do it up here. No problem. No problem. Okay. Now, I work on this hamstring. I want to make sure the hips is working. So now, what I'm doing here, I'm going around close to the bikini line. Just make sure they feel comfortable with that. And I come up this way. So I want to stay in this side. I come up around me, around my shoulder, and I came right in here. Lower this down. You feel okay? And you lower this down. Yeah? So you see, I'm trying to get straight. What do you feel?
It's a good stretch.
Yeah?
Yeah.
Okay, you can go by yourself now. Hold on, it's coming out. Sometimes it's tricky to go around, so you see I have to remember how to do this one. Yep, just like that.
Yeah, that's better.
Yeah, so you see, so I'm standing up here and I ask her to, yeah, a little bit lower down. I'm activate all those muscles.
Okay, that's good.
Yes, she feel it. She said it's good. Right? This is what the physiokinetic line, guys. It's a Paul Kelly. He's doing classes. If you guys in Boston, Florida, and Washington State, he's gonna be all this year, and he's showing amazing stuff. This is his Fabulous 4 technique for the hip mobility, and also help with the lumbar area. Next one, we're gonna bend this way right in here, and you bend this way, and you do the same thing. You raise this way. Keep going. Make sure your customer. And I can create more. You see, it's go around me. I'm just standing up here, and she's working for me, for herself, not for me. Bend the knee. Let's roll out, no problem. See how you feel.
Good.
Yeah? Is it different? Try to walk. Let's see how you feel. Try to stand up. Really? Okay. This is how you teach how you get up the customer from the bed, okay? From massage table. So when they lay down, they have to lay down on the side. You can help them out. Now they're gonna roll this leg right here, and they have to push with this arm away from the table. So you push right in here. Push this up and raise up, and you help them out all the time. And this is how you get up from your bed all the time, every morning. Now try to walk. See how you feel.
It's good. It's stronger.
Yay, it's stronger. This is what called this medical kind of manual therapy. This is really gonna help. Okay, releasing muscles.
Without massage.
It's old technique, and this is not really productive for helping people.